Introduce yourself.
Hello, I'm Louise Signal. I'm an academic from New Zealand. I'm at the University of Otago in Wellington, and it's been a great pleasure to be here at the CRE retreat over the last 3 days.
Fantastic. And I think, a lot of people are very interested in what's happened in New Zealand since you've had a change of government. What have been some of the major developments that have had implications for health equity?
I think one of the very big ones is the Prime Minister's commitment to child well-being and the commitment of the government to well-being overall. We're seeing a real shift in the way Treasury is thinking about the accounts, and we're now having a budgeting system for well-being. So I think that's going to be quite transformative. The second thing is that the Prime Minister has been really leading on child health and child poverty reduction, and so we have a child poverty reduction bill which is before the House, and that has attracted cross-party political support for the first time, and that is a very significant move.
And what are the factors that have helped child poverty reduction gain traction politically?
Well, 29% of our children were living in poverty. It was an absolutely unconscionable fact in our developed country. I think it's partly to do with the fact that our welfare system has been predicated on work. And so once you get unemployment, then you get significant poverty. We've also got still quite a low wage economy in some ways, certainly compared to Australia. Our minimum wage is something like $16.50. So people are earning a lot less than they would be here in Australia. And so you get the working poor, if you like, and of course then those beneficiaries. That, of course, is extremely socially patterned, so we see that Māori are hugely more overrepresented in the unemployed, and of course young people as well. So really a significant move, I think, in strengthening the resources that families have at their disposal, which should, I think, float all of the boats in a sense. It should make a difference to health across the board.
What are some of the elements of the child poverty reduction bill?
Well, so this is going to ensure that about half of our children will be out of poverty, thinking about the 60% average line for poverty. But it still means that we'll still have quite a number of our children still in poverty, and I think we really need to be very bold and visionary, and I would really like to see the Prime Minister and the government as a whole move to make sure that none of our children live in poverty. To my mind, that would be really the critical way to future-proof our country.
And do you think there's lessons there for Australia as well?
I don't know the Australian context as well. I think that we have quite a simple political system compared to yours. We have a unitary state, so we don't have state government. So then we only have really, if you like, one model of health. This is how it's done. There's not the opportunity to do things differently in different states. So in some ways you get a very bald, exposed kind of analysis of what's going on in terms of the impact of neoliberalism. New Zealand has had a very, very strong neoliberal agenda. I think we're continuing to argue over how strong our neoliberal policy is compared to how much we're going to go in a social democratic directions, such as that of the Scandinavian countries. Very much when I was growing up, there was a strong welfare state, as I said, predicated on work, but now we just do not have that. How do we get back to that? Well, in my view, we need to go in the direction of social democracy. I think that's, and we need to rush there, in my view. But we're still, I think, far too on the right in our political spectrum.
Sure. Now, you're one of the keynote speakers tomorrow at a Global Health Equity Policy Symposium in Canberra. What are going to be your main messages there?
Well, I've been reflecting on what we can learn about social determinants for equity in New Zealand. We've had some really big gains. The two areas where I think we are making progress at the moment is this issue of child poverty reduction. We've seen that from our fifth and our sixth Labour governments, but we've also seen a real development in the area of housing, which is particularly critical for us because we have such poor quality housing and such poor, cold, damp weather. And so we've been seeing that issue over the last 20 years has really been on the agenda, and that's to do with a lot of factors coming together, but the very skillful work of my colleague Philippa Howden-Chapman and her wonderful team, and I guess a degree of political willingness, and perhaps the fact that there isn't a significant corporate opposition in this space. So I'm really looking forward to seeing the new rental warrant of fitness work, which seems to be getting up the agenda now, so that we will, I think, improve the quality of our rental housing. We've already made a step in that direction. There's more to go there. That would make a huge difference to the well-being of all New Zealanders, and certainly for those who are living in poor quality rental housing.
Fantastic. Look, I know you have to get a bus to Canberra, so I'll say thank you very much for spending time with us, and good luck for your presentation tomorrow.